Hi and welcome. My name is Bengt Andersson and I work at Nordic Welfare Center as a senior advisor in the area of welfare technology. And I will be your moderator today during this webinar. Since 2020, Nordic Welfare Center cooperate with and coordinate the Nordic Research Network, health and welfare technology with focus on user perspectives. And there is a lot of research going on in this area. I was a little bit surprised coming into this network, working with these researchers, that there are quite many researchers and research that has been going on over the last 10 years in this area. And today the network consists of nearly 90 researchers from all 5 Nordic countries with focus on health and welfare technologies. And at today's webinar, we are going to have focus on a research project called PROTECT project. Proactive health and welfare technology for Nordic users and societies. And this project has been a part of the research network's activities during the last years. Helinä Melkas, professor at Lund University of Finland, and Kristin Gustafsson, professor at Sophiahemmet University in Sweden, will present the project. And after that, we will have reflections from user perspectives from Stig H. Nilsson from SPF Seniors Sweden, and from policymaker perspective from Björn Alexander Andresen, program manager at the Welfare Technology Program at Helsedirektoratet, the Norwegian Directorate of Health in Norway. And we have, you can't use your mic or camera as a participant on this webinar, but you can use the chat function. So please don't hesitate to put questions, write down questions to us here at the webinar. I will forward the questions to our presenters, and we have a panel discussion at the end of this webinar where we could put your questions. If you would like to have captions, subtitles, you can just click on the show captions function in Zoom, and there will be a text coming up helping you to follow this dialogue here. Okay, let's start. And first I would like to welcome Helinä Melkas. Helinä is a professor at Lund University in Finland, and she's been very active in starting up this research network that we have. Also Kristin Gustafsson. Both these professors are very active in this network, collaborating with us at the Nordic Welfare Center with different activities in this area. And both of them are members of our core group of this network. So with this introduction, I would like to give the word to you both, and I think you will mix between you both presenting this PROTECT project, Proactive Health and Welfare Technology for Nordic Users and Societies. So welcome Helinä and Kristin.
Thank you very much, Bengt. And yes, we will be presenting together, and I will begin with the basics of the project. If I'm able to change. Okay. Yes, so PROTECT, as Bengt already mentioned, stands for Proactive Health and Welfare Technology for Nordic Users and Societies. It wasn't a research project as such, but it was a networking project where we synthesized and with that advanced Nordic research-based knowledge about this topic of proactive health and welfare technology, HWT. We had both a user and a societal perspective, or actually we had 3 perspectives, but I will go to these levels a bit later. My university, LUT University from Finland, was the coordinating organization, and we had also Norwegian Center for eHealth Research, Danish Dementia Research Center, and Mälardalen University as partners in the project. And the project itself ended in June this year, but we are still distributing or disseminating the results and building on the results in various occasions. And actually, I think Christine will tell a little bit more about recent activities in her part. This was a networking project because of our funding. We were funded by the Joint Committee for Nordic Research Councils in the Humanities and Social Sciences. Via Nordforsk, its secretariat is at Nordforsk. Currently, it was actually at Academy of Finland during the first part of the PROTECT project. We have received great support from Nordic Welfare Center and the Nordic Research Network on Health and Welfare Technology. So, why did we have this project? The use of health and welfare technology is it's more and more visible. You can see health and welfare technology being used in new circumstances, in new tasks. Maybe partly because of the recent great uptake of digital solutions in healthcare and social care due to the corona pandemic, for instance. So this type of of technology is playing an increasingly important role in many ways in users' lives, whether we talk about end users, their informal caregivers, or professional users, in care work, more generally speaking, and care processes, and also in our societies as a whole, in the Nordic countries, but also, of course, elsewhere in many other countries. And since this is becoming so important, we also need new understanding. We need to advance research-based knowledge and understanding of these different levels, so to say. We need to understand end users and informal caregivers' needs, and we need to understand implementation-related topics, and we also need to build up more and more systemic understanding related to organizations and the societal level. We can often see that technological solutions may be taken into use too late in an older person's life, for instance. And so it's really important to try to be proactive so that they would be taken into use early enough when the person, the user, can still really benefit from the solution or the device. So proactiveness is one topic that we wanted to also advance with the help of our project. The Nordic countries are in many ways similar, but of course there are also many differences. You could say that they are sufficiently similar and sufficiently different for a project of this kind. So this Nordic region provided an excellent environment for our research or our project. It seems that it's taking some time to change the slide. Sorry about that. So how did we work? We focused on these three levels that I already referred to in Nordic workshops. And the micro level concerns the end users and their informal caregivers. The meso level concerns the implementation level, professional caregivers and their organizations. And the societal level is then the macro level. We were able to have nearly 200 workshop participants from the 4 countries, Finland, Sweden, Norway, and Denmark, in our workshops. And that was really a great way to work. It was really interesting to have a combination of researchers from many different scientific disciplines, and also many types of stakeholders from, for instance, user organizations, caregivers organizations, decision makers from different levels, local, regional, national, ministry representatives, and I'm probably not even remembering everyone now, but there was, and of course there were also differences between the countries. So a broad range of different stakeholders. And the researchers, as I already mentioned, it was a very multidisciplinary group from many different scientific disciplines. From care sciences and health sciences, there were many researchers involved, but also from many others, such as educational sciences, engineering sciences, and so forth. And this is really key in my view, because we cannot and should not look at this topic from the perspective of one scientific discipline only, but it requires a combination of different perspectives and also different methods, research methods. It was essential for PROTECT to support early career researchers. We had many early career researchers involved from all these 4 countries, and they had an opportunity to present their research at these international workshops, and also get feedback concerning their doctoral studies. So these early career researchers were or are working on their doctoral dissertations or newly graduated as PhDs. We also wanted to understand the diversity of users and value users' voices, and this is one of the reasons why we had also many user representatives or user organization representatives in our workshops.
Yes, thank you for this, Helinä. Christine Gustafsson is my name, and I'm a professor in healthcare sciences at Sophiahemmet University in Stockholm, but I'm also an affiliated researcher at Mälardalen University, which was one of the partners in the PROTECT project. I'm going to present you the results from the project, but first we're going to start with some kind of definition of health and welfare technology that we use as a concept in this project. Health and welfare technology is used as an umbrella concept covering a variety of technologies with the aim of supporting people in general, citizens, including patients, older adults, and people with disability, as well as their relatives, to achieve better health, independence, activity, participation, safety, and security. For care staff, the expectation of health and welfare technology is an improved working environment. And additionally, healthcare and social services organizations expect health and welfare technology to support, for example, logistics, data handling, and the provision of more effective healthcare and social care services. Some examples of the kind of technology that are included in this use of the concept is e-health, telehealth, telemedicine, telerehabilitation, m-health, and home monitoring. And now we're going to move over to the results of the project. Health and welfare technology use does not occur on only one level. it affects and is affected in numerous ways by the 3 levels of micro, meso, and macro, and the dynamics between them. We will start with the micro level. To successfully support the use of health and welfare technology, it is necessary to first understand the challenges it faces and the opportunities it provides at the micro level. Knowledge is needed for such understanding to emerge. A starting point is to acknowledge diversity and people's individual circumstances. We concluded that one size does not fit all. In principle, anyone can be a health and welfare technology user. At the same time, users can have professional roles. Users have varying needs and may lack awareness of, access to, and ability to use technology or make sense of information related to health and welfare technology. The main Nordic challenges and to us knowledge needs at the micro level, the end users and informal caregivers has been identified, as you can see in the slide. About digital exclusion, for example, what kind of active support and how much support is needed, and what is sufficient to decrease and hinder digital exclusion. Active work with digital inclusion is also a way to move forward, while the process of digital transformation continues in healthcare and social care services. Many people could benefit from the use of health and welfare technology, but are yet its users. It's essential to consider how to motivate such non-users. Moving to involvement of current users, the development and refinement of new methods to involve users should be focused on. Overall, building knowledge about the micro level would benefit from the development of research methods and especially collaboration among different scientific disciplines. In general, the implementation of technology is challenging and does not occur automatically or in a vacuum. Major efforts are required for truly successful implementation, such as those to develop management practices, train professional caregivers, and find shared language amongst all the involved. Safety, security, and ethical issues are an integral part of health and welfare technology use. To deal with these issues, there should be a deep understanding of the everyday life of health and welfare technology users, and the prerequisites for meaningful technology use should be carefully considered. We also need to develop research methods so we better can contribute with research in the area of health and welfare technology use. Challenges and opportunities at the meso level depend on local characteristics, needs, and prerequisites of the organization, the community, municipality, or alike. One size does not necessarily fit all, even at the meso level. Each care organization and its personnel, clients, or patients differ. To us, their knowledge levels, implementation challenges, and opportunities and needs for change management also vary. The main Nordic challenges and to us knowledge needs at the meso level, the professional caregivers and the organizations, excuse me, have been identified and related to change management. It's about introducing the use of health and welfare technology changes care processes and the traditional ways of working and giving care. Also, professional caregivers' working environment changes in line with the introduction of health and welfare technology, which requires planning, development, and assessments. Anchoring of the implementation of the technology is a key issue. The prerequisites in the organization and services need to be known. For example, concerning money, time, existing knowledge, and infrastructure. Care personnel and employees' understanding and knowledge of technology use also needs to be increased. The incentives for introducing health and welfare technology need to be more clear. What would technology be? Why would technology be used? What technology should be used and how? What is available, essential, and useful, and for whom? What kind of education, training, or other competence building are needed? We also have identified knowledge needs regarding knowledge. It's about decision-making processes and leadership, participation, co-creation, collaboration, and assessment of needs. The importance of introducing technology which corresponds to real needs related to decision-making. Careful attention is required concerning procurement and system administration. The interoperability of digital products may be a challenge that requires understanding and the broader infrastructure and its readiness to integrate new solutions. And finally, impact studies and cost effectiveness studies are needed. There's a large need of this kind of studies looking into the impact of health and welfare technology has in practice. Does the technology do what we want it to do or expect it to do for the care professionals, the organizations, and of course the end users? And is it cost effective? Moving to the third and last level, decision makers plays an important systemic role in the societal strategies and planning related to health and welfare technology use. They need sufficient knowledge and a systemic understanding of the broadness of the topic and its links to services and the entire service system. While health and welfare technology use has increased across the Nordic countries, there is a lot to do in encouraging, promoting, and even formalizing the use via policies. Decision makers has a crucial role in consolidating this trend by establishing line of actions that could be followed to improve the condition for health and welfare technology use. The main Nordic challenges and throughout knowledge needs at the micro level, the decision making has been identified as follows. The results further confirm the importance of building knowledge on the impact of health and welfare technology use to find out about those, including economy and perspectives such as cost. For decision makers, systematic reviews on what is known are essential. This means, for example, the need for a clear categorization of solutions that would enable systemic monitoring of the appropriateness of solutions for different types of users and their impacts. It would also ease the identification of various knowledge gaps. Various stakeholders should have the opportunity to participate in identifying research gaps concerning health and welfare technology and its use. Such identification requires understanding and focus on the micro, meso, and micro levels, and decision makers have an important role to play in this. Decision makers' role in supporting the implementation of change management is crucial. The implementation of technology as a part of the care process requires new knowledges and competencies. The big picture of economy of well-being was emphasized, where it is concluded that we need to be more proactive. Yes, Helinä.
Thank you, Christine. And we will move on to the key messages for the future. it was not an easy task to, let's say, squeeze all this information from the workshops into key messages, and there are obviously also many other things that should be and could be emphasized, but we came up with 4 key messages for the future. And the first one is related to collaboration. Firstly, it's essential to really truly involve a diverse range of individuals and organizations, and decision-making organizations as well, from the user, organizational, and societal spheres. And when I say truly involving, it means that these individuals and organizations should not be just targeted as objects, but really participate and have their voices heard in these health and welfare technology related processes. Secondly, it's important to take into account that this health and welfare technology topic is really, or requires, multidisciplinary and interdisciplinary thinking and work. As I already brought up in the beginning, we cherished that in our project, but it's also generally speaking important for the future, so that we can build knowledge collaboratively among different scientific disciplines, and also, of course, a broad range of stakeholders from different fields. It's also important to promote really bottom-up participatory and action-based policies, so that also, for instance, grassroots care professionals can participate, and end users can participate in knowledge building. And this needs to concern both needs identification, implementation topics, related topics, and assessment of impacts and effectiveness, and knowledge building more generally. For instance, when you talk about needs identification, you cannot really identify needs properly, I would say, without really bottom-up processes, because it's not enough to kind of assume what users need. It's really important to listen to them also. Secondly, the second key message is related to orientative activities. So it's quite typical still nowadays that quite technologically oriented training is provided when some health and welfare technology device or solution is brought into use. But that's not sufficient. It's important to provide more than training, to expand the focus towards orientative activities, as it says in the title, towards a more comprehensive and continuous process of training and familiarization of technology in a co-creative way. This continuous character is also important because people typically need reminders, they need new training sessions. So just providing, for instance, half an hour of very technical training is not sufficient if we want to really build up more long-term use and implementation skills. So in addition to mere introduction, it's also important to really learn multifaceted knowledge and skills for this type of technology's effective use. And moreover, it needs to be remembered that such orientative activities should absorb even critical views and questioning attitudes concerning technology. Not everyone is right away willing to take into use such solutions, new solutions or devices, and it needs to be known why, or should be known why, and these critical views should be somehow also responded to, so that we can come up with more sustainable use. And the third and fourth key messages for the future are related to consensus and diversity. First of all, related to consensus, again, it's a question of embracing joint learning and creating new awareness together. Perhaps it's not possible to really reach a full consensus about everything, but this joint learning and co-creation is important. And as Christine already mentioned, there are many different, or let's say, neighboring concepts related to health and welfare technology. So those should also be clarified. What do we actually talk about together? And this kind of knowledge building concerning the concepts and features of these technologies is also crucial. Designing policy conventions or designing policies in collaboration with key stakeholders, also including companies, is one more point that we should pay attention to in the future. So stakeholder involvement is absolutely key for this area of activities. Diversity, you have heard about that already many times during this presentation. So we need to acknowledge different users' needs and also different users' responses to technology. Again, referring to perhaps also questioning attitudes and critical views. So one size definitely doesn't fit all. And the policies at micro and meso level, they need to be developed so that they are targeted to the circumstances in question and differentiated where necessary. Digital exclusion is a big problem, and therefore it's also necessary to work actively towards digital inclusion. The process of digital transformation continues. We can see more and more digital services being taken into use. And while it continues, we still need to remember that not everyone is equally skilled and equally ready for various reasons to use digital services. So this inclusion topic is also very, very important. And we discussed these PROTECT results in also a broader European context at the European Social Services Conference in Malmö in June. And we had quite a big audience there from European countries, but also outside of Europe, many participants. And there was a wide agreement about these results. Obviously, there are also many national differences, national emphases, and national needs. And needs within the different countries can be very different. But in general, the participants of this workshop felt that we had recognized some key results in this project. And I will hand over to Christine.
Yes, thank you, Helinä. As a continuation of the PROTECT project, we have also invited the business sector, the health and welfare technology companies, to discuss the results. And as you heard in the earlier presentation, we didn't do that in the workshops. We didn't have any business representatives. But Here in the beginning of the November, we participated in the Norwegian National Conference, E-Helsa in Norway. And we invited some companies to discuss the results from the PROTECT with us. And to have, what should I say, shared point of departure in the discussion with the companies, we started with an illustration of quadruple helix collaboration, which includes the public authorities, the governments, parliaments, for example, and also the civil society with interest groups, the different parties, and different organizations related to this area. And of course, it also participated researchers representing academia, but also companies. And having this illustration, it could be a shared point of departure in the discussion of how we could collaborate better and what can we do together. Another way to also illustrate this area is to look into the use of health and welfare technology as an ecosystem. And this is an illustration of this, how this could be seen as well. It's about the end users as patients, older adults, people with disabilities, and their relatives. And we also add the professionals, the healthcare and social services professionals. And we add academia, the research area about research and development, evaluations, and the contribution by knowledge. But of course, also the governments, the policymakers, which also have needs and regulates this area by different laws, and also, of course, funding for this kind of technology that we introduce in healthcare and social care. And here also comes the companies, the business in this area, and also the civil society and stakeholders. It's also about needs, but it's also about the proactiveness in this area, this work, and also to know about what is available. So this was discussed at the conference in Norway 2 weeks ago. And we also involved the audience by asking them what collaboration they would prefer, and also why we should do it. And we had invited the multinational company Atea Norway and Atea Finland to share their experiences of incorporating research into their operations. And we ended the session with a panel discussion with representatives from both academia and the business sector, discussing opportunities and barriers for collaboration in scaling up the use of health and welfare technology. And during that session, it was highlighted that the business sector finds it challenging to navigate research and its results, as they often appear siloed and fragmented. This situation leads to multiple researchers working on the same issues without being aware of each other, resulting in numerous pilots and ineffective use of resources. Representatives from the business sector emphasized their need for extensive research, including studies of cost-benefit, healthcare professionals' experiences with technology, how services can be organized, and end users' experiences. However, they noted that consumers rarely request research results, and many are more concerned with today's solution than those of tomorrow. Furthermore, it was pointed out that many companies, especially small ones, have limited resources to connect with research environments and find relevant studies. At the same time, many researchers are hesitant to align too closely with the business sector. So the business sector and researchers often have different incentives for collaborations. Researchers may be more focused on publications, while the business sector wants things to work and have an impact. So in summary, the necessity of close collaboration was emphasized by both parties. To strengthen this, there is a need for a common platform for communication between academia and the business sector. And here it comes to the last slide.
Yes, you can find our policy brief. We produce a policy brief of a couple of pages for decision makers first and foremost, but also for anyone interested in this topic, with our results and recommendations. You can find it with the name in the LUT-PUB database of LUT University, or you can use the QR code on this slide. And you can also see the PROTECT team members' names on this slide. And I would also like to mention that the nice visualizations were an important part of the workshops. We had a person doing live visualization of the discussions, and her name is Raquel Benmergui. Thank you very much for your attention. And back to Bengt, please.
Thank you very much, Christine and Helinä. You will come back after I have had a chat with Björnar and Stig H. So I recommend you, all your participants out there, to put down your questions in the chat forum, and I will take these questions and bring them over when we are together, all presenters here, a little bit later. But now it will be interesting to hear from a policymaker perspective, and we have invited Björnar Alexander Andresen to join us here. And I'll have a couple of questions to you and hear about your reflections of the presentation and of this project. So let's see if we have Björnar with us. Yes, there you are. Nice to see you, Björnar.
Thanks the same, Bengt.
Tack för sist.
Tack för sist.
We met a week ago in Oslo at the EIN conference that Christine and Helinä mentioned. You've been very active in this project. I know you have. I think you have been at all three workshops, haven't you?
Yes, I've been lucky enough to be able to participate. It's been very nice, very interesting all the way.
Yeah, and an open question first. What's your reflection?
Well, I think, first of all, thanks a lot for the opportunity to comment here, and also thanks to Helinä and Christine for taking us safely through the presentations and the projects. My reflections as a policy maker, so to speak, like you said, we're part of the Norwegian Directorate of Health, so we're working to improve health of the citizens and the community as a whole through targeted activities across services, sectors, and administrative levels. So we like in between the politicians and the healthcare services, and we also have a role in implementing welfare technology in Norway. So my initial impression of this presentation and also of the project is that it's very relevant. I think perhaps one of the things that I like the most is the different levels that you address in the PROTECT project. By the way, PROTECT project is a very difficult thing to say in Scandinavia.
It is.
Yeah. but the combination of user and societal perspectives and the focus on both micro, meso, and macro levels, it ensures that you're relevant for actors in all levels. And as a national policy-making entity, we're of course particularly interested in the macro level. So that's been very interesting to follow. especially that level, but all the levels of this project.
And when we listening into elements to consider and key messages that has been presented here, do you recognize yourself in this? What it brings in the program you have for welfare technology in Norway? Do you recognize the elements that they have been considered and the key messages that is brought up?
Yes, absolutely. Particularly some of them. One thing that we have been working a lot on is the digital inclusion, and that has been also something that you pointed out as something important to take part in, to have focus on in the continuation here. We have just had I've just come from a conference on AI, and I'm thinking there are so many possibilities in welfare technology and digitalization of the healthcare services, but there are also many challenges. And I think it's very important to address the digital inclusion because it's something that doesn't it doesn't do itself. We can think that elderly people are being more and more are coming from the digital age, but there are so many ways to be confused. There are so many dangers. You get fake emails from your healthcare services telling you to give your credit card information and so on. So even though you were digital a few years ago, you might not be digital anymore. So focusing on the digital inclusion is very important and an important aspect of being able to receive healthcare services digitally in the future. So that's one of the key messages.
Yeah, and I just hang on to that because I think that's very interesting, and I think I'll talk with Stig H about this as well. But I mean, you could see it from different perspectives here. One is that there are people that are digitally excluded, but as Christine and Helinä also said by the end of the presentation, last week they had a dialogue with the businesses, with the industry, and I mean, in your universal design and open up, making it easy to use these kind of services also is an option. Maybe not so often mentioned. Do you how do you work with the industry and businesses in your connections?
We're addressing them, and they have a good focus on this, I think. So all the solutions are being more and more user friendly. This is going in the right direction, I think. But also the ones with the motivation to trick people to fake actors, so to speak, they are also following in the footsteps. It's always, things are getting easier and easier to use, but it's also easier and easier to get fooled by digital solutions. So I think we need to address the end users and make sure that they follow us on this digital journey, so to speak, safely.
Yeah. I think it's interesting. You see, between these levels, micro, meso, macro level, there are things that go through all levels when things. Some example of essential elements to consider, but there are also a couple of classical elements to consider. So that comes from the different levels, and one is from the macro level that is important with the impacts and costs. I don't know if you want to comment on that.
Well, absolutely. Like you said, initially, I'm program manager for Norwegian Welfare Technology Program, where we try to implement technology, and we have to do this in a knowledge-based way. And to do that, we depend heavily on research. And research and results from it is crucial to be able to continue the promotion of welfare technology in municipalities and in hospitals that we're working on. And there are naysayers out there. There are particularly traditional medical environments that feel that the research has not come far enough when it comes to documenting saved costs or saved time through technology. So I think your focus on these things on the macro level will be very important. It will be very important to motivate the politicians, but also to motivate the healthcare providers to join this digital transformation. So and also, like I know the PROTECT project has also been a very important arena to meet, to network in the research environments. And I know that you also are starting, some of you are starting a focus on climate impacts, which also is a macro level viewpoint here. I think it's very important to get more research on those fields as well, to motivate us to take part in digitalization of the healthcare services.
Yeah, because we're going to be the most integrated and sustainable region by 2030, and we need to work on all cross-sectoral areas here. That's important. We also see one very important element to consider is what also this project is about when you look at the macro level is proactiveness, to be proactive, something that very much came from highlighted, and that is more explained, preventive care. How can we help our citizens to be more think and work, be more prevented?
Absolutely, and that is very important. Of course, we are all Nordic countries. We face some of the same challenges that you mentioned. We have an aging population. We will have a lack of healthcare personnel. We need to be proactive to prevent unnecessary need for heavy-duty healthcare services in the future. Because we will be fewer people to be able to deliver these services. And I think that you have shown and you have indicated that welfare technology can be part of this proactiveness. There are other means as well. We can change the way we deliver healthcare services. We can have more focus on prevention. We can have more focus on rehabilitation, but welfare technology will most certainly be a part of this proactiveness. So you're very good at highlighting this and documenting this in the PROTECT project.
All right, Björn. I have more questions, but we can take them when we all gather together again, when Stig and Christine and Helinä comes back. So I thank you for now, and you'll be back very soon, and we will go over to talk to Stig H, who comes from the Swedish SPF organization for pensioners. Welcome, Stig H.
Thank you.
Thank you. And you've been in this. You were in the first of these three workshops when we talked about the user perspective. And what's an open question to you as well? First, what's your reflection on Helinä and Christina's presentation about PROTECT?
Well, I think they have pinpointed many of the essential issues we have here with the digital future and with all these type of new gadgets we're going to use. Especially, I think I will highlight a few of them, and one of them that even Björn has spoken about is the digital exclusions of people, and not only elderly people, which I represent, but also handicapped people and people with without money to buy into that. And that is where we really have to do more of it. And I'm mostly concerned about the very elderly, which are maybe isolated back home, are not out in the society. They are sitting there and they are met only with the personnel from the home care systems. We don't reach out to them. We are running a lot of digital training in my region for now, when we have an enormous interest from people like me who are interested and see the benefit of them. But there is a certain amount of people that are negative to it. They don't have the means for it. They might not even be aware of what they can achieve with it. And that's where we have the biggest issue, and how not let them be on the platform when the train runs. And that's where the social security system will have a major responsibility, not maybe to teach them, but at least to inform them. And then that brings back to the personnel that we do today have in the home care system, their level of knowledge of this. Everything from digital things to language issues. That's a very big challenge. To bring them back on the train, and let them be aware of what's the benefit of being a digital person in the society today. What is the benefits of it? They will not buy in all of them, but I think we can get more of them, because today the transition of social services and health services is moving very quickly into digital ways, and we will exclude people. And the other issue is that we talk about user involvement. We have introduced new ways of communication with our local GP or the local doctors, which, if you're not really trained in digital interfaces, you will be excluded. And I think this is something very important, that we involve the end users much earlier than they are doing today.
I will get back to you more about that, but I wanted to reflect a reflection that I have done. I've been also, as Björnar, had participated in all of these 3 workshop, and to inform you all participants listening to this, the first workshop, repeat that the first workshop was on the user level, on the micro level. And that workshop sort of set the agenda for the upcoming workshop out of a meso and macro level. And you highlighted then, and you highlight now, Stig, digital exclusion as a very important area that we must handle, and that sort of had an impact on the upcoming workshops that were performed in this project. And I think we haven't really got the answer how to solve these issues, but there are, as you mentioned, and also Helinä mentioned and Christine mentioned, there it is about knowledge, information sharing. How do we reach out to these people? One area that we discussed with Björnar is what can the businesses do? What could we have more universal design in the services they have? Could it be easier to use some of the services? Could it be easier to use bank ID? You've been in the business quite a lot. What's your reflection, Stig?
I certainly think it could be done. We could do much more research, testing with the end users on several levels to make sure that the interface is adapted to elderly people. And the other thing we have found out is that training elderly people should be done by elderly people. We think differently, we move differently. We are not so skilled as the younger population, so we take it in a slow pace. And I think that's a way forward, but also to make sure that the support function is there. It's one thing to go into a training for a few hours about using for instance, the bank ID. But if you don't use it on a regular basis, you forget about the tricks. So there must be some backup from the society, how to work with this. And things are moving now, at least in Sweden, that we know of. Some cities have introduced a digital service that you can call off if you're old enough, and they will come home to you to train you, to fix problems. But that's just a few cities in Sweden that has this service. The rest of us is just fumbling in the darkness.
So if you take, you listen to Björnar here present the policymakers and the work they do in Norway. What would you like to recommend policymakers to do? What should be done?
First of all, I think these support functions should be introduced everywhere. Secondly, I think we have to involve the personnel much more. Those that are out daily to the elderly people, which are today mostly digital excluded, they have to be involved in such a way that they don't feel this as a threat to their job, or that is another burden on them. That should be a help for them. So they are interested and motivated to help their customers or users to be more active in this field. There will be, of course, limitations to it. We will not reach out to 100%. So we can't forget them. So there always have to be backup system in old ways. But the majority can definitely be transferred, be more digital. And I would say that elderly people are not afraid of learning things or trying out things, but they have to do it in their pace.
Yeah, we still see. We think that that digitalization would sort of comes with what we've been doing at work, but we still see that there is a lack of knowledge, even if you had worked a lot with computers, etc. During your work time, and then it takes quite a short time to lose your competence in this area. In fact.
And don't forget that the digital world is developing as well. So even we who think we are trained in it and used to it, we have our challenge to cope with it. Think of AI or things like that, which that will be also a challenge to use that.
And if you've been following this, and you also heard Christine and Helinä presenting here, if we go into the research needs and what we need to do more research, what's your reflection on which area we should do more research in this perspective?
Well, I think one of the key issue is how do we reach out to people? So it's not we have the digital solutions today. They are those that we can introduce today, but how to get it implemented and to reach the end user, to make them, let's say, accept it. The security is of course a vital issue here, because what I hear when I meet with people that are not digital, that they are the only thing they say, we are just screwed up, and they want to even try it and try out what the benefits are. And what do we read in the papers today or in the news programs? It's always about all the frauds and the fakes, not about the benefits of it. And I'm a little bit disappointed that there hasn't been more development on security, like Bengt you're speaking about. Why can't we? There must be ways to make them that even more secure than it is today. We cannot come to a situation there is no fraud or fakes, but we can definitely make it more difficult and turn it around in a more positive way, that a digital world gives us so much more, especially when you're ill, you're sitting home, you can still participate in cultural events and read your magazines or whatever. You won't be isolated, but we have to bring that message to the end users.
Yeah. Good, fine, Stig. Hang on. I think we'll go on and invite Björnar, Christine, and Helinä to join us in the final discussion here that we have together. Discuss. Let's see if everyone comes in here. Yes. Okay, Good. Now we are all here. Thank you again for being here. And first of all, I think again, you all, both Christine and Helinä, you mentioned it about the method here. I can't really just let that go. I think there's a very interesting method. We've done this through these 3 workshops, and I think that both the hybrid version of this, we had to do it due to the pandemic, but that was very well. We had over 200 participants in these 3 workshops that has joined this project. But again, nice to hear anyone have a reflection on what I discussed with Stig, that we started up with the micro level and had the first workshop from the user perspective, and that sort of set the agenda for the upcoming work. I don't know if Björnar, Christine, and Helinä, if you have any reflections on my reflection on that. Yeah, you just talk. You don't need to raise your hand. Put off your microphone and have the microphones on, and we just talk. I think we do that like that.
Yeah.
Christine?
Yeah, this is one of the good effects of the pandemic, since this was not the plan from the originally planned for the PROTECT project. But it was a lucky, it was successful by that, because we could then include so many participants. And as you said, we conducted it as hybrid. We'd have our national discussion, but then we shared the results of this discussion and also some key speakers in different areas during all 3 seminars, or workshops where we conducted this. And as you said, Bengt, I think it was a good method for this work, because we could cover a larger amount of people and also different stakeholders in this area. And if we look into the first session where we discussed the micro perspective, we had, for example, older adults, representatives by older adults, and also representative for retired people's organization, but also representatives from disabled people's different kind of organization. And I think this was a good way to do this work, that we kind of merged the knowledge, and also in the analysis of it, raised it to a more meta Nordic level in this project.
Mm.
I agree in what Christine already said. It's not really possible in practice to separate between the levels. I think that we kind of touched upon some points from the other levels during the workshops too, but that's not really the point. I mean, or that's not a problem, because you shouldn't separate them entirely. It's really, as you said, Christine, in the presentation, it's really also very much about the dynamics between the levels, and that should be also focused on. So I think it was a nice way that we kind of had to innovate during the project, but it was a nice way to move towards systemic understanding that then covers all these levels.
Mm.
And we also kind of learned during the process, it was an environment or participant who allowed us to trial and error in this area. And to be honest, it was, Helinä, it was quite hard work to figure out how we should do the workshops, and also how to handle the technology, the challenges due to that, and also to have this kind of process thinking that we start at one level and then we try to move to another level. But I think it turned out very well. And of course, if we should do it again, we have these experiences, and also we could make it even better a second time.
Mm-hmm.
If I'm going to add something here, I from my perspective, I think these workshops have been very good. They work very well, and like you said, it's it was almost lucky that we were in the. It's wrong to say that we were lucky to be in a pandemic, but we had some gains digitally during that period, and conducting these workshops as a hybrid meeting. I think that worked very well. Then you could have some discussions between the countries, and then you could also have some sessions, just on a national level. And it was also very interesting to be from the start to be invited in as a policymaker to talk about the needs for research from our perspective. So because that's not always, it's not always easy for the policy making perspective and the research perspective to meet, but you facilitated that from the start, and that I think is it makes this more useful. It's a more useful approach from my and our point of view. So that worked very well, I think.
Mm-hmm. Okay, I'll jump in right to the chat because we have had questions from the chat. It's from Ranveig on Iceland that wonders if there's a big difference between services for the disabled and the elderly. For the rest of you here in Iceland, whether it's digital service or not, services for disabled are light years ahead of services for the elderly, so it differs a lot on Iceland. Do we have any reflection on that from Sweden, Finland and Norway?
Yeah, I had some reflections where I can refer to my time when I worked in Eskilstuna municipality. The organization is that there is an elderly care organization in the municipality, and there is an LSS organization. It's about the people with disabilities. And from my experience, both the staff and the people with the disabilities are a bit more on their toes, so to say, more interesting or more eager to include this kind of technology in their everyday life. I don't know the reasons for that. Maybe that the staff have a more perspective that they should support the persons with disability, for example, with the intellectual disability, in their daily life to be independent. And this is one of the main expectation of health and welfare technology, to support people to be more independent, or maybe to stay independent during the life. So my experience is the opposite to Ranveig, that I think that the organizations working with people with disability are a bit forehead compared to elderly care.
Could that depend on the volume of caretakers you have?
It can be that, but I think it might also be based on different attitudes in the organization, and also the staff's attitudes towards using technology to support the people they care for, their independence. Yeah.
If I'm going to add, yes, it's an interesting question, and it's not. I think, of course, some of the disabled of a younger age group in Norway, we use more resources on them, so that is true. When it comes to the digitalization of the services or using technology, I don't really think it's easier or more emphasis on that group. So I agree with Christine here. It's in Norway, I think perhaps there is more awareness, and it's more straightforward to implement welfare technology in the services for the elderly. And I think there are different reasons for this, but one of the reasons I think is perhaps that younger disabled patient end users, they're moving between sectors. They get healthcare services, they are at school, kindergarten, work, the social sector. Sometimes it's very difficult to have technology that works on all sectors and all platforms and arenas. So it gets more complex. So in our experience, it's more complex and more difficult to implement welfare technology for that group. It can be than for the elderly. So yeah, the emphasis on resources is high on that group, but not necessarily easier to implement welfare technology for it.
Yes, from the Finnish perspective, I maybe find it a bit difficult to compare the practical services, because we haven't done so much research on services for people with disabilities actually, but I would say that there is generally more interest or more, let's say, higher hopes towards technology use in services for older people. And quite often those hopes are maybe a bit unrealistic too, because the challenges are also bigger. You were Stig Håkan, you mentioned that if you were digital a few years ago, you may not be digital anymore in older age, and that's one of the reasons why in elderly care technology use encounters perhaps even more bigger problems, because people's let's say health condition can change even very radically, even in a very short time. So in the case of people with disabilities, maybe the let's say opportunities stay more similar over the years.
Mm-hmm. I go on with a question from Judith from the Swedish National Association for Persons with Intellectual Disability. She says that they are concerned about the ethical aspects involved in the use of welfare technology in group homes, for example. They see an increased interest in replacing staff with technical solutions just to save money. I don't know what your reflections is. It's not a question. It's a reflection. And what's your reflection on that?
I think this is a very important aspect, and I agree 100%. It's very important to focus on the ethical aspects. However, there might come a time in the not too distant future where the alternative is not necessarily continuing giving the services in these homes as we did before. Perhaps in some places, technology will be our only way of maintaining a level of services, because there is so much lack of people, lack of staff personnel. So I agree absolutely. We need to take that the ethical aspect into consideration, but I think in some cases it's not really about saving money either. It's about being able to maintain a certain level of healthcare services. So in some cases, the digital solutions, it might be the only solution, especially in the not too distant future.
And I also think that it's a kind of a game changer here, where we might have technology that could offer other ways to have support in your daily life. So maybe if we have technology that could support, for example, a person with intellectual disability to be more independent in their daily life, maybe staff not is needed. So maybe it's another way that we need to also change our way of understanding what support in daily life is and can be, and how it could be given. I'm not saying that it might be an incentive that we need to save money, of course, but maybe we also have to raise the question on a more personal level about the effects, how it affects the person with intellectual disability. Because from my experience and understanding, it's important to be independent, even though you have this kind of disability. So if we could support this, I think it might be a good thing. But then again, here the research area could contribute maybe with this knowledge to help us to understand the effects of this? Is it just to save money, or could we maybe support people with this kind of disability maybe to a better life, better quality in their daily life? But there are so many expectations, but we don't have the evidence. And as I see, this is one of the mission for the academia to support this organization with this knowledge.
From our perspective, there is a fear that technology will replace people in the home care, but we don't have any evidence for that has happened.
Yeah.
Although I think that we have to be open to some areas, like say you have a night patrol coming to visit instead of having a camera. Maybe we have to be rather rude here, that we can't afford having night people running around using just to make a visit, instead of having a camera that can monitor you all the night. So I think there are areas where we definitely can have this discussion, that we go for digital or technical solutions instead of personal, but not in a general way.
Mm-hmm.
Christine was talking about effects, and I would also highlight that kind of knowledge, the importance of it. So when we talk about impact assessments, they should really be done early on, before something is even implemented at the planning phase. So there should be already an assessment, a multi-method assessment, preferably utilizing both qualitative and quantitative methods, so that we would already have information for the planning, and then impact assessments, meaning recognizing or identifying both positive, negative, and neutral impacts. Those should be also done during the implementation phase and during the use of the technology. So that's really, I mean, they kind of bring up the user's experiences as well. And when you think about some savings, for instance, are they really savings? That's one thing that can be brought up via skilled impact assessments, because often savings can lead to increased costs elsewhere. So this is why we also need this systemic understanding more and more.
Yeah, I totally agree with you all. And I just we have no Danish perspective here, but I could just, from my Nordic perspective, look at the countries and the perspective that you have had in different countries. And in the Danish perspective, they are the one that invented the expression welfare technology, velfærdsteknologi, and they have always been talking about that it is cost effective. You should save money using these kind of services. They have left that a couple of years ago. It's a lot of focus of more hands in healthcare and social care, and what could digital solutions do to make us handle the situation where we need more people, we need more services, and we need more both quantity of services but also quality of services. So they sort of left this save money perspective to how can we handle this situation? How could we still have the same quality and quantity in our service model? So I think that's quite interesting. That is so clear from Danish perspective. We have another question. I think it's Ulrika from Gothenburg. Gött att guys gick upp och Blåvitt klarar sig kvar. Here comes a question. Often get asked why we in the municipality-driven healthcare aren't using welfare technology in a wider range. What does the science say today?
Yeah, I think the science says the same thing. There are a lot of pilot studies, and when the project money is used, the pilot is finished, and it quite often it doesn't lead to any wider implementation of the welfare technology. And For example, in Sweden, there are 290 municipalities, and it's all this kommunalt självstyre that the municipals have their own decisions. And it means if we are planning to introduce some kind of new technology, we have 290 ways to do it, and all of them need to do their own evaluations. So there are some systemic challenges in these areas as well. We are looking very much into Finland, how you work in this area now.
I think it's important to get the local citizens to work closer to each other. They always claim that they are different and they have to do it the way by themselves. But that's just a waste of money. And I think the government has to be stronger in that, to force cooperation. If something works in one municipal, it should work elsewhere as well. Why do you have to invent the wheel again?
Mm-hmm.
I think you also said something about that, how to reach out and how important it is with the good news about this, not just the problem. So I think storytelling is a good way to work with this. And also, as we found, Helinä, in the Orient project, that we also need to work with the citizens that they should know about this technology is available. Then we also could make them to demand the technology, because it's hard to ask for something you don't know exists. So we have some kind of orientation task in this area to educate the citizens. What is available and how could it support us?
I like to bring up this issue that the collaboration between industry and academia to get things moving, to get further, say, what you find out in the academic world into products which can be used. And I would like you to look upon what's happening in, let's say, traffic safety in Sweden, where there is an umbrella in the Chalmers Institute of Technology called SAFER, where there are people going for their doctorate degrees, but they are employed by various companies. So they work in between the industry and the university, and by so sharing the information and the knowledge, where you easily understand each other, what you have achieved in the academic world. And you see the same in Germany, that a lot of top engineers are moving between universities and the industry, and there is no, let's say, fight in between. They are more or less collaborating this way in order to get the best out of what the academic world is bringing in knowledge. So think about that.
Yeah.
If I'm also going to just add a little perspective,
yeah, of course.
And then, I would like to say that I would very much like researchers to look into financing systems when it comes to promoting welfare technology. We're always talking about there are so many pilot projects and it doesn't get implemented. And I would like to know what role the financing system has. Our municipalities are often block funded. Could you introduce a little element of activity-based funding to increase the use of welfare technology, and also to have some connection between the budgets in the municipalities and in the hospitals, so that you could look you could see the gains from both perspectives. If welfare technology in the municipalities can prevent going into the hospital, could we find a way to investigate further into that? So actually, should we look more into the financing systems of our municipalities, especially on this field, on welfare technology and digitalization? I'd like to have more research on that.
Yeah, we could. Sorry, it's just 1 minute left. Sorry, Stig. I think we must need to finalize this webinar, and I think you gave me, Björnar, an idea for a new webinar here, looking into, because I think what's going on in Finland when you're talking about social reform there, where everything is put into one organization, is something that is very interesting to look into, and that welfare model, financing model as well. Okay, everybody, this has been a fantastic, interesting discussion we've had, and thank you for your presentation. Thanks very much, Christine and Helinä. Thank you, Björnar, also known as Elon Musk of some of our participants here looking into, and Stig, you're the new Anthony Hopkins, as we've heard here. So okay, thank you very much, and have a nice Thursday evening. Bye bye.
Bye bye.
Thank you. Bye.
Thank you. Bye.